Good afternoon, everybody. Welcome to our webinar. We're going to go over Hoag Medicare Benefits today. And my name is Henry Liu, and I'm just going to give you a little overview today about Hoag Hospital. And then we're going to give you a Medicare overview presented by Jeanette Paterka. And then we're going to have individual Medicare health plans give you an overview of all the benefits they have available for you for this year. I'm going to give you a little information about Hoag. Hoag has 2 hospital campuses that are located in Newport Beach and Irvine. We have 14 urgent care centers and 9 health centers throughout the county. Hoag's medical staff includes more than 1,700 physicians and represent 52 different specialties. Hoag includes 5 specialized institutes of excellence: neurosciences, cancer, heart and vascular, women's, and orthopedics. About Hoag. Hoag is designated as a magnet hospital as part of the American Nurses Credentialing Center's Magnet Recognition Program. Hoag is the highest ranked hospital in Orange County by U.S. News and World Report for 2021 and 22. Hoag in your community. Hoag Health Centers. We have Hoag Health Centers, and we're committed to providing health care services in the communities we serve through Hoag Health Centers. We're located in Aliso Viejo, Costa Mesa, Foothill Ranch, Huntington Beach, Irvine, Irvine Woodbridge, Irvine Woodbury, Newport Beach, and Tustin Legacy. Hoag in your community. Our Hoag Urgent Care provides care 7 days a week just for life's unexpected illnesses and injuries. We're located from Aliso Viejo all the way through Tustin Ranch. We also now have a Hoag Flywell Clinic located in the John Wayne Airport, Terminal B, and it's pre-security. Access to primary care. How do you get to see our primary care doctors? Here's a simple way of doing so. Access through Hoag Medical Group, or you access your primary care physician through Hoag Physician Partners, HPP. Hoag Medical Group has primary, urgent, and specialty physicians. We have 100 plus physicians, 21 primary care locations, 13 urgent care locations, and you can find us online at hoagmedicalgroup.com. Hoag Physician Partners. We have 10 primary care physicians, 350 plus specialists to serve managed care patients, and you can find us online at hoaghealth.org/HPP. Hoag Medical Group. I'm going to give you a quick overview of Hoag Medical Group. Once again, we have over 100 physicians with specialties from family medicine, internal medicine, pediatrics, sports medicine, all the way through to palliative medicine. We have locations once again in Aliso Viejo, all the way through to Tustin. Some of the features of our Hoag Medical Group is we have same-day sick appointments for established patients. We accept most major HMOs, PPO, and Medicare insurance plans. We really pride ourselves on unrushed, personalized visits. Hoag Physician Partners, HPP. That's our IPA, or our Independent Physician Association. We have 10 primary care physicians, over 350 specialist physicians representing over 50 specialties. Our recent additions include Orange Coast Women's Medical Group, which we have over 20 OBGYN physicians at 6 locations, providing an integrated care model for women as they move through all stages of their lives. We also have Hoag Gynecologic Oncology, Hoag Urologic Oncology. You have access to the network, including Hoag Health Centers and our Hoag Urgent Care. If you need to contact us, please call 1-800-369-9247. Okay, I'd like to turn over the presentation to Jeanette Paterka, who's going to give you an overview of Medicare, and I'd like to turn over the screen to her now.
Good afternoon. My name is Jeanette Paterka, and I am a licensed agent. I am here to walk through the description of Original Medicare. So the screen that you're looking at right now is a copy of your Medicare card, or if you're not yet opting into your Medicare benefits, the card that you will be receiving from Social Security for your Medicare. The things you want to take a look at this with this card is you want to make sure whenever you enroll into any type of Medicare Health or Part D prescription drug plan that you transcribe the information exactly as it's listed on your card. So as an example, this gentleman's name, John L. Smith, if you were to leave out the middle initial L, it could technically or possibly pend or hold up your application. So you want to make sure you transcribe all of the information exactly as you see. The Medicare number, as you see there, the Medicare identification number, is an alphanumeric number. Previously, Medicare, up until about 2 years ago, used to use an individual Social Security number, but they did change that, so it is now an alphanumeric number. That is the number you would need to put on an application as your Medicare number. And then, as you can see, there's Hospital Part A and your Medical Part B effective dates. Those are the coverage dates of your Medicare insurance. So what is Medicare? Medicare is health insurance for the following people. If you're 65 or older, or if you're under 65 with certain disabilities. So that basically means if you're deemed disabled with the Social Security Administration, you can possibly be eligible for Medicare. If you have end-stage renal disease, so that means that you are actually receiving kidney dialysis or Lou Gehrig's disease. There's also different parts of Medicare. So Part A of Medicare, as I referenced on the Medicare card, Part A and B. Part A covers hospital, skilled nursing, hospice services, outpatient surgery. I like to think of it as the facility portion of Medicare. So whenever you go into a facility, it's going to be covered under your Part A of Medicare. And Part B covers the services that you receive. So your doctor's office visits, any inpatient or outpatient therapy, home health care services, labs and testing, those are covered under Part B of Medicare. And Part C of Medicare is offered through private insurance companies that have a contract with Medicare. So what that means is independent companies, the ones that you're going to hear speak about their benefits today, they actually, each of them have a contract with Medicare, and they are able to offer you benefits under the Medicare program. You want to make sure what's very important to remember is that you're not actually ever signing away your Medicare. I've had individuals say, I don't want to sign my Medicare away to a specific company. You're basically just telling the Medicare administration that you want your Medicare to be, your benefits to be provided by an individual company. One of the great benefits of this is that each of these companies has to offer benefits at the baseline, the minimum of what original Medicare would offer. But as you're going to hear today, they all offer benefits that are much more enhanced than original Medicare. And then in 2006, Medicare rolled out Part D, prescription drug plans. So in 2006 in January, these are independent companies similar to the Part C plan, so they have a contract with Medicare, and they can offer Part D prescription drug coverage. This Part D coverage can be paired with an individual that has original Medicare, so Part A and B, or if an individual has original Medicare and purchases a Medigap or Medigap policy, or and then they can go ahead and purchase the Part D to go along with it. So there's different parts of Medicare, and there's different ways to obtain your Medicare benefits. So most individuals, for Part A, if you have worked and paid into the system, basically a deduction on your payroll check for 10 years or 40 quarters, you are going to obtain your Part A of Medicare without any charge. Now, if you happen to be a stay-at-home, let's say a stay-at-home mother, and you didn't work your entire working life up until Medicare age, you did not work that 40 quarters or 10 years. If you have a spouse that has been paying in and drawing their paying into the Medicare system, you are able to obtain your Part A at no cost based on your spouse paying into the system. Part B of Medicare, all beneficiaries must pay a Part B premium, and it's dependent on income, and in some cases it may be a lower amount or a higher amount depending on how much adjusted gross income that you have on an annual basis. We're going to go ahead and go through a grid. What you want to remember about Part B is if you're going to obtain your Medicare health and prescription drug coverage, you have to have Part B. I've had individuals or known individuals who canceled their Part B of Medicare because they really weren't sure why they were paying it. It's deducted out of your Social Security award, the money you get from Social Security every month, and they've actually canceled their Part B. This is not an option if you want to opt into Medicare for your health insurance, because if you don't have Part B, Medicare will cancel your health insurance. Now, as I mentioned, you do pay this via Social Security. It's deducted out of your award for Social Security. But if you're still working and you decide you want to opt into your Medicare benefits and you don't receive your Social Security award or money at this time, they will bill you on a quarterly basis. Part C of Medicare, as I mentioned, Medicare Advantage. You also hear the acronym MAPD. That means Medicare Advantage prescription drugs. That means it's the health and the drug plan all together baked into one. As I mentioned, this is through private insurance companies. They're approved with Medicare, and they can go from zero all the way up over $100 premium per month. And if you have one of these plans and it has a premium, you need to pay the premium for Part C for your Medicare Advantage plan, as well as your Part B premium. And then again, as I mentioned, Part D of Medicare also has an additional premium. So this is the 2021 Part B income-based premiums. You will note there's a few places in the presentation where I have highlighted information in red. So what this means, the information in red is actually indicating the information for 2022. Medicare doesn't always release everything all at once, and so information trickles in. So if you take a look at this grid, if you're an individual and you make $88,000 or less, or if you're married and you file your income taxes jointly and you make $176,000 or less, this is adjusted gross income. Each individual on Medicare is going to pay in 2022 $158.50. This is the amount you're either going to have deducted from your Social Security money, or you're going to pay on a quarterly basis. And then as you see, the grid goes all the way down. If you go to the second to the bottom, $165,000 in one, and up to $500,000, or $330,000 in one, and $750,000. Those are the amounts for either a single person or a married filing jointly. If you're a higher earner, each person has to pay $475.20. Please note, all of these ranges below that first line are numbers for 2021. Eventually, Medicare will release the total numbers for everybody, for every age, for every income bracket for 2022. It's just not there yet. And then potentially, you could also have a Part D additional premium. As you can see, that lowest level of income, the $88,000 or less or the $176,000 or less, there is no additional premium for Part D. But if you do earn more, if you're one of those higher earners, you can potentially at the very bottom, if you're $500,000 or greater than $750,000 for a married couple, your Part D premium would be $77.10. Okay, enrollment periods. So we're going to talk about the different times that you can enroll in Medicare. So this particular slide is specific to an individual that's going to be turning 65 and wants to enroll and start their Medicare benefits when they are effective, which is usually the first of the month you turn the age 65. So you do have actually a 7-month window, though. They give you a window to enroll. A window to enroll. So in this particular diagram, month 4, say, is your birthday month. So my birthday's in September. So if I am turning 65 on September 15th and I decide I want to opt into Medicare, it is going to start on September 1st. If I contact Social Security in months 1, 2, or 3. So if I contact Social Security, let them know I want my Medicare benefits to begin, then they will begin the first of the month that I turn 65. But you do have that 7-month window to enroll. The next enrollment period is the annual election period. That is the time of, this is the time of the year right now when we are in the middle of the annual election period. You can, if you're already on Medicare, you can change or enroll into a prescription drug plan. You can change your Medicare Advantage plan. You can return to original Medicare. You can enroll in a Medicare Advantage plan if you're only on original Medicare. This is the time of year for you to be a good consumer, advocate for yourself, take a look at the plan you currently have if you're on Medicare, and then decide if those benefits are going to work for you for the following year. So anybody that's on a Part D or a Medicare Advantage plan should have received approximately the first week of October what they call the annual notice of change. They call it the ANOC. That's documentation comes from your existing plan, and it tells you what the benefits are during the current year. So in October this past year, the ANOC would have shown what your benefits are for 2021, and then it would have shown what your benefits, the changes to your benefits will be in 2022. These plans can and do change benefits from year to year. So this is when you need to take a look at those benefits and decide if those are going to work for you. Now, if you decide you want to make a change, the application, in order for it to be effective on January 1st, has to be submitted between October 15th and December 7th. The next enrollment period is what they call the open enrollment period. This is from January 1st to March 31st. So if you're on a Medicare Advantage plan, you have a one-time opportunity during this period, January 1 to March 31, to switch to a different Medicare Advantage plan. You can drop your Medicare Advantage plan and return to original Medicare Parts A and B, or you can sign up for a standalone Part D plan that will go along with your Medicare Advantage plan. The effective dates of this is from month to month. So say you submit an application on January 20th, it's going to be effective on February 1st. Say another example, if you submit an application on March 2nd, it will be effective on April 1st. And then whatever plan that you're on, effective on April 1st through December 31st, you are then in the lock-in period. And this is the time when most individuals must remain on the existing plan that they chose, the one that you're actually on, starting October 1st through December 31st. So Medicare knows that everybody needs to be locked in, but there are some special circumstances, some special reasons, and the ones I have listed here are the ones that are most common. These are special reasons to actually make a plan change after that April 1st effective date. So from April 1st up through the end of the year, you can make a change if you move out of the current service area. So Medicare Advantage plans are filed by county. So if you live in Orange County and you decide to move up to San Luis Obispo County, you actually need to enroll into a new plan because they can have different benefits from county to county. So they'll allow you to do that throughout the year. You can also enroll in a Medicare Special Needs Plan due to some chronic conditions. Some of the health plans have some of the health insurance companies have plans specific to individuals that have certain diagnoses. So a couple of examples are if you have diabetes or if you have congestive heart failure. There's certain insurance companies that will offer a plan specific to an individual that has one of those diagnoses. Many times, a good reason to make a change to one of these plans is it might offer a broader array or options on the prescription drug benefits that are specific to that particular diagnosis. And then we have full dual beneficiaries. These are individuals that have both Medicare and Medi-Cal. So Medicare is the federal program, Medi-Cal is the state program. And then LIS, low income subsidy. I'm going to talk about that a little bit more in a couple slides, but this is for individuals that are on a lower income but not necessarily on Medi-Cal. Okay, prescription drug coverage. What you want to know is that this is the baseline. Remember I said all the companies have to offer at least the baseline or better benefits. So this is the baseline for 2022. So the initial phase is the initial coverage limit. So you need to pay $480, so your deductible of $480 during the calendar year. So, or in the beginning of the calendar year. So say you go in January and February and you pay for your prescriptions. Once they hit $480, then what happens, so you pay the first $480 and then you have a combination of payments. And the initial coverage limit goes up to $4,430. It's the total annual drug costs combined with what both you pay and what your prescription drug plan pays. So to illustrate that, if you have a prescription that costs $25 and you have a $5 copayment and your insurance company pays $20, $25 is going to be put towards that $4,430. So you're going to be paying your copay up until, you'll pay your copay throughout the year. And then once your combined drug cost, the total cost of your medications reaches $4,430, you're going to move into a different phase, which is called the coverage gap or the donut hole. It's a different way that you pay your prescriptions. It's a temporary change. So the way that it works is once you hit $4,430, you're going to pay 25% for your generics and 25% for your name brand medications. So you pay 25% for your medications until you hit a total combined drug cost of $7,050. And then that's what they call the catastrophic limit. If you happen to hit this limit, many individuals don't hit it at all throughout the year, but if you have some prescriptions that are a little bit more costly, you may hit it. So once you reach that $7,050, you're going to pay $395 for your generics or $985 for your brand name prescription drugs. So I mentioned low income subsidy. What that is, it's a state program, and it's for individuals that are on a fixed income. They maybe they own a home and they don't qualify for Medi-Cal, but they are at a lower fixed income. You can go to the Social Security's website, and there will be a link that will say Extra Help or LIS. You want to click on that link, and you can see what the actual income levels are. I would invite you that even if you believe that your income is a little bit over the levels that they are quoting of what the guidelines are, submit the application. It's fairly simple, because sometimes what they do is they don't include all of the income that you may think that they would include. So you may qualify. If you qualify, you will be notified. And if you qualify for the LIS, you're going to pay $0 to $395 for your generics and $0 for $985 for your name brand medications. So this is going to be the last slide that I go through. This is what they call the Medigap comparison chart or table. Sometimes you hear Medigap, sometimes you hear Medicare supplement plan. Basically what this is individuals on original Medicare, that's the A and the B. Original Medicare does not cover 100% of the cost, so you can purchase an additional Medigap or Medicare supplement plan that helps fill in those holes that Medicare doesn't cover, so it fills in the gaps. So a couple things to remember about this. If, say, as an example, you were looking at a Plan N all the way to the right-hand side of the grid, a Plan N, these plans are standardized. So if you have a Plan N with Mutual of Omaha or Blue Shield of California or United Healthcare, the benefits are going to be identical, so it is standardized. So basically, a Plan N is a Plan N. What you want to look for is the reputation of the company. So you want to make sure that you're working with or looking at a company that has a strong reputation. You want to look at the monthly premium. Each plan can offer a different monthly premium for that same set of benefits. So a Plan N might be $100 with one carrier, and it might be $115 with another carrier. So take a look at the pricing. I'm also going to ask you to focus over to the right-hand side, the far right. Plan C and F are only available available if your Medicare eligibility date was prior to 2020. So Medicare from time to time will change the benefit structure of their plans. A couple things about that. If you enroll into a plan and you remain on that plan and you never let it lapse, you always pay your monthly premium, even if Medicare changes the plans, you will always be on that original set of benefits. Referring to Plan CNF, they're no longer available for individuals prior to 2020. So say if you turn 65 in 2018, but you're still working or your spouse is working and you're on the employer group plan of either your employer group or your spouse's employer group plan. So you don't need to really necessarily opt into Medicare coverage. But the fact that you are eligible potentially, that you're eligible before 2020 means that when it's time for you to go into Medicare, when you want to start your benefits, you will be able to actually choose a plan C or F. So you want to remember that. So with that, what I'm going to do now is we are going to hand it off. We're going to go through each of the Medicare Advantage plans. They're going to go through their lead plan. And the first plan that we have up today is going to be Anthem Blue Cross, and it's Lauren Mullis. Thank you very much.
All right, good afternoon, everyone. My name is Lauren. I'm with Anthem Blue Cross. I'm a direct field agent here in Orange County. Today, the plan that I'm going to choose to go over is that middle one on the screens you're seeing right there, that Anthem Medi Blue Select, our HMO. Okay, so we're going to start out with the star rating. We have a 3.5 star rating on this plan and a $0 monthly premium. Any primary care physician or specialist visits are going to be a $0 copay. And your maximum out of pocket is going to be only $900 for this plan. Your hospital copay for an unlimited number of days in an inpatient hospital stay will be $0. Your emergency room copay will be $90. For your ambulance, your ground ambulance copay will be $200. Your outpatient surgery copay, $0 as well. And for your first 20 days in any skilled nursing facility, you're going to be looking at that $0 copay as well. X-ray, laboratory, MRI, CT scans, both $0 copays. Any diagnostic testing, physical therapy, or urgent care visits as well in network will be that $0 copay. Going into our prescription plan built into this, you're going to have a $0 copay for any Tier 1 prescriptions. Tier 2, you're looking at a $5 copay. Tier 3, $42. Tier 4, $95. And Tier 5, you're looking at a coinsurance rate of 33%. For our dental coverage, this plan comes with built-in vision, dental, and hearing. For your dental coverage, we're going to give you 2 exams, 2 cleanings, and 1 x-ray, all for a $0 copay. Your hearing aids will give you 1 exam and 1 fitting for $0 copay and a $3,000 hearing aid allowance through our partner Hearing Care Solutions. For your vision, we're going to give you 1 exam for a $0 copay and then an additional $150 allowance for eyewear. We also do offer Silver Sneakers, which is complimentary gym membership, as well as online fitness classes that is complimentary to you. Transportation, we will give you 12 one-way trips at a $0 copay. And we also include 2 essential extras, which I'll discuss more in detail in the next slide on this plan that you get to select yourself. Included in this plan as well is still that awesome PERS benefit. It's that 24/7, 365 emergency access device. It can be used for non-emergency as well. It's a very small little pendant. You can tuck it inside your shirt, give you and your family peace of mind should you ever need it, with that built-in mobile detection so it could be used in and out of the home. We also have an over-the-counter allowance on this plan. It is going to be $80 a quarter, so that is $320 allowance annually. You can use it at Walmart and CVS to purchase participating items such as vitamins, flu medications, and other everyday household items, okay? Next, we're going to discuss what's new in 2022. Starting January 1st, you can select 2 essential extras on that HMO MediBlue Select plan. On your screen here, you'll see a bunch of different options. Some do need to have a qualifying condition and others do not, and I'd be more than happy to give you an assessment on those. Just to touch on a few, a very exciting one, we have a Flex card. It's going to be a $500 MasterCard that you can use at participating dental, vision, and hearing retailers. So if you're in Walmart and you want to go into that vision center and you see a nice pair of eyeglass frames that you want and you already used your $150 allowance for a different pair of eyeglasses, no problem, you can go ahead and use that Flex card. Or if you're at the dentist and you need a special kind of crown that you can't seem to find coverage for, you can go ahead and use that $500 MasterCard to help you out. Another exciting one is our Healthy Groceries. We'll give you a $50 allowance every month on a separate card. You can go to participating grocery stores such as Albertsons, Ralph's, Vons, anything like that. CVS and Walmart are also contracted in this. You get $50 a month. You can go ahead and use that to purchase healthy grocery items such as produce, wheat, meats, anything like that. You can use that $50 allowance. You'll get that once a month, okay? And that does not roll over, so you got to make sure to use that up every month. Other exciting ones is that health and fitness tracker. You can elect this benefit to receive a complimentary Fitbit sent to you just so you can monitor your health a little bit better. We also have a transportation benefit that you can add on. If you feel that 12 one-way trips is too low for you, you can go ahead and elect this benefit and you'll get 60 additional one-way trips on top of the 12 for a total of 72. All right, some other great ones. We have Healthy Groceries. You can get 2 meals a week delivered to your house for up to 90 days if you feel the need for that. We have Assistive Devices. We'll give you a $500 allowance for things such as handrails, stools, shower guards, anything like that at all. And there's just a bunch of great different ones such as pest control, in-home support, personal home helpers. You'll see the full list on your screen right there. Again, some do need a doctor's approval, but I'd be more than happy to work on that with you. And again, you can select 2 on these MediBlue Select HMO. All right, so it's just an exciting way to customize your plan even further for you and your needs. My information's on the screen right there. Should you be interested or need to find out more, please feel free to contact me via phone or email, and I'd be more than glad to help you. All right, and with that, I'm going to be passing it on to Blue Shield of California with Diana No. Thank you.
Good afternoon, everyone. My name is Diana No, and I am an independent insurance broker representing Blue Shield of California today. My contact information is going to be in the chat box to the right, but for my folks that are not tuned in, my number is 949-226-4064. So Blue Shield is a not-for-profit company based here in California. They've been around for 80 years in the healthcare market. They offer a variety of products such as Medicare Advantage, Medicare Supplement, as well as prescription drug plans. So what does that mean to you? They're a one-stop shop, right? They'll have a product or a plan that best fits your needs. So for today, Blue Shield actually offers many Medicare Advantage plans. So depending on what your needs, if you're special needs, your dual Medi-Medi, chronic conditions, there's a plan that fits you. But for today's session, I will be reviewing the leading plan, which is called Blue Shield Inspire. And this will be for 2022 in Orange County. So if you have your little chart, you're welcome to take it out, and I'm going to go through the benefits. Alrighty. So in front of you, you see the benefit highlights, but for the presentation, I will be taking a deep dive of the specific benefits as we go down the worksheet. So for the Inspire plan, it is a 4-star rating. There's no additional premium besides what you pay to Medicare. So you continue paying your Medicare, you join this plan, you pay $0. For your primary care and your specialty visits, like your endocrinologist, your cardiologist, it's a $0 copay. Your annual maximum out-of-pocket is $7.99. What does this mean? This is the most you'll pay out-of-pocket for your medical expenses for the year. And as I go through this list, we'll have some medical expenses, co-payments. It will go towards that maximum out-of-pocket, all right? As for your hospital copay, for unlimited days, it's a $0 copay. If you go to the emergency room, they patch you up, send you home, it's an $85 copay. However, if you are admitted to the hospital, then that $85 copayment is waived. This plan also includes worldwide coverage. What does that mean? So once you start traveling domestically, internationally, you are covered for emergent and urgent care services worldwide at unlimited expenses. As for the ambulance, if you call the ambulance, it's a $100 copay per trip. Outpatient surgery, so this is for the not-so-fun colonoscopy, or if you get the cataract surgery, same-day type of procedure. It's a zero copay for the ambulatory surgical center. However, if you're high risk and your doctor says, you know what, we want you having this procedure at a hospital facility, then you are paying a higher copayment. It's $150 per service. Moving on to skilled nursing. So let's say you have hip surgery. You're well enough to be discharged from the hospital, but not 100% well enough to go home. You may be discharged to what's called skilled nursing, so rehab services. For the first 20 days, it's a zero copay, but if you're there from days 21 and on, it's a $50 copayment per day. So you might tell me, Diana, what if I end up staying there for 100 days? Am I subjected to thousands of dollars for the skilled nursing copayment? My answer is yes and no. You are subjected to that maximum out-of-pocket of $799, okay? So once you hit that $799 for the year, you're done paying for copayments for your medical and hospital services. Moving along to the next items, a lot of zeros. So we have the x-rays, labs, MRI, CTs, PET scans, diagnostic testing, if you need physical therapy, speech therapy, occupational therapy, as well as urgent care. It's a zero copay. So for all those services I mentioned, you pay zero, alrighty? Moving on to prescription drug coverage. So with Blue Shield, they have a very strong formulary. So they cover a lot of medications that you may not find on other plans. So as an independent broker, I'm here to help you explore your plan options, run analysis, and let you know, okay, which plan will give you the lowest out-of-pocket costs when it comes to your medications, all right? So on Blue Shield, if you pick up your medications at the pharmacy, so specifically the preferred pharmacy, we're looking at Costco, CVS, Walgreens, Walmart, not Walgreens, Costco, etc. That is the preferred pharmacy. So I'm going to go down the 5 different tiers. Tier 1, it'll be a zero copayment for a 30-day and a zero copayment for a 90-day. As for Tier 2, it's $3, $4.50. Tier 3, so these are your brand name drugs. So it's like your Eliquis, your Jardiance, insulin like Humalog, Lantus. You're going to pay $35 or $87.50 for a 90-day supply. As for Tier 4, it's $95 and $237.50. And lastly, Tier 5. These are the specialty, typically your injectables, chemotherapy medications that you're probably picking up at the pharmacy. You're paying a 33% coinsurance for those medications. And then this plan does not have a Tier 6. I know I'm zipping quite quick, but bear with me. We also have dental coverage. It is included in this plan. It's embedded. It is an HMO network. However, you do have the option to upgrade to a dental PPO plan if you are interested in having your own doctors, not being restricted to a network, okay? Hearing aids is also included. It's a zero copayment for the exam. And if it's determined that you need a hearing aid, you have 2 options on this plan. You have the silver technology for $499 per ear or $699 for the gold technology. And the hearing aid vendor for Blue Shield is called Epic Hearing. As for vision coverage, also included, zero copayment for your exam. And if you need frames or contact lenses, you get a $200 allowance every 2 years to use towards frames or contacts. And the vision administrator is called VSP. So you may have heard of VSP when you're working for a company. So this is the same company that is administering the benefits. Moving along to health club membership. So this plan also includes coverage for the local gyms through Silver Sneakers. You may have heard Silver Sneakers, the name quite often. So they work with LA Fitness, 24 Hour Fitness, YMCAs, many of the local gyms, and you can belong to all the gyms if you choose to, okay? Let's say you like the 24 Hour Fitness because they have extended hours. I do because I'm a night owl, so I don't mind working out at midnight, but maybe you might like the sauna or the lap pool at LA Fitness. You can certainly go there as well, all right? Transportation is also included. You get 32 one-way trips for your doctor visits, urgent care, lab work, etc. Now moving on to the extras. So this is the fun bells and whistles, right? This plan also includes over-the-counter allowance. So you get $100 each quarter to order items like cotton swabs, cough drops, ibuprofen, vitamins. And you're able to order twice quarterly, but you have a $100 allowance to use If you don't use it, you lose it. This plan also includes the personal emergency response system. So you may have heard in the past, help, I've fallen, I can't get up, right? That's the device I'm referring to. It's a medical alert device through a company called LifeStation. Depending on your lifestyle, activity level, you can get either the pendant, wristlet, or the GBS mobile device at no cost to you, so zero. This plan also includes acupuncture and chiropractic visits, right? So if you like the alternative type of medicine services, this plan includes it. You get it's a zero copay for 24 visits each. So you get 24 acupuncture as well as 24 chiropractic. And lastly, something new that Blue Shield has added to their plan, home delivered meals. So upon discharge from the skilled nursing or the hospital, sometimes it's hard for you to get back on track to day-to-day life, meal prepping, etc. So per discharge, this is a company called LifeSpring. They will deliver 22 meals and 10 snacks per discharge at no cost to you. All right. As I mentioned earlier, Blue Shield offers Medicare supplements. They have very extremely competitive rates for the Plan G and Plan G Extra. And lastly, don't forget, we are in the annual enrollment period, right? We have about 36 days left. So if you are interested in learning more about your Medicare Advantage options, Medicare supplements, as well as prescription drug plans, you're welcome to contact me. My number is 949-226-4064, right? So thank you for your time, and I hope we connect soon. So now I am going to introduce my associate, Joanne Bidet, with Scan Health Plan. Thank you.
Hi, I'm Joanne Boudet with Scan Health Plan. I'm so happy you guys could come here and see us today. I represent Scan Health Plan. We are a not-for-profit organization. We are located locally here in Long Beach. Our member service is there in Long Beach as well, and we answer our phone. Isn't that interesting? You can call member service from 8 in the morning to 8 o'clock at night, right now 7 days a week. But you can also call me. If you enroll with me, I will be your agent of record, and I will be available to you all year long or years from now if you need any help or have any questions in regards to Scan Health Plan. We are a Medicare Advantage plan, and today I'm going to talk about the Venture Plan. We have multiple plans. We have a plan that's designed for folks who have diabetes where our insulin is a zero copay, which is amazing. But today we're going to talk about a brand new plan that is actually going to put a little money into your pocket. We're going to give you $125 back of what is being deducted from your Social Security for your Part B. In other words, we will let Social Security know that we're going to pay $125 and then you're going to pay the balance, which next year will be around $33. So it'll be really nice when your Social Security check comes up and it's $125 larger than what you've expected. And we're going to do that all year long. That means that you'll get an increase in your income of over $1,500. Okay, so with that plan, it is a star-rated plan at 4.5 stars. We have no premium involved, so you don't pay anything extra. Primary care and specialist is going to be a zero copay, as well as maximum out-of-pocket is going to be $1,000. Hospital copay is zero. Emergency room is $90, but it is waived if you are hospitalized due to the emergency. Ambulance is $155. Outpatient surgery is zero if it's done at a surgical center. It could be $225 if it's done at the hospital. And the skilled nursing facility, it's zero for the first 20 days. And if, unfortunately, you have to stay longer than 20 days, it would be $100 a day. X-rays and labs, zero. MRIs and CT scans are $75 copay. Diagnostic testing is 20%, and physical therapy is $5. Now, all of those $5, $155, all are going to be included in that $1,000 maximum out of pocket. So even if you had a catastrophic illness, you would not have a catastrophic financial situation because the most you would pay in copays would be $1,000. Okay. Prescriptions, urgent care, is a zero copay as well. And we do cover you for emergencies and urgencies worldwide. So you could be out of the county, out of the state, or out of the country, and we're still going to cover you for emergencies and urgencies worldwide. Prescriptions, we have 5 tiers. Tier 1 and 2 are your generic medications. There'll be a zero copay whether you get a 30-day or you get a 3-month supply. And then we have Tier 3 is a $30 copay. Tier 4 is $95. If you need to get a Tier 3 or 4 prescription and you want to get a 3-month supply, you would get a $20 discount for that. And we have a mail order service. It's called Express Scripts. They'll mail you a 3-month supply. And at Scan, a 3-month supply can mean 100 pills, not 90. As long as your doctor writes a prescription for 100 pills, that's what we're going to give you for a 3-month supply. Tier 5 is specialty drugs, and that would be a 33% copay. Dental, we use a group called Delta Dental. It is an HMO dental plan, but it is a discounted plan. All of your routine cleaning, x-rays, and even a deep cleaning are all zero copay. And then if you needed something larger, like a root canal or a filling, that would cost you anywhere, you would get it at a 30 to 60% discount. Hearing aids, we use a company called True Hearing. Those are retailing for $2,000 to $4,000. Our price to our members is $450 to $750. That's great savings on a hearing aid. Vision is iMed Vision Care. You go in and get your eyes examined, no charge. You can do that every year. And then we give you a $250 allowance to use towards your eyewear, either your frames and lenses, or you can use it towards contact lenses. That's $250. And the eyewear would be every 2 years. Health club membership, silver sneakers. Transportation is also provided, and that would be 24 one-way. But all the extras are what make me excited about Scan. We have chiropractor, acupuncture, podiatry. We have a health tech where you can call a board-certified physician 24 hours a day, 7 days a week, 365 days of the year. And that, because it is a physician, they can actually write you prescriptions, and you can call them on the telephone. They can do visit with you on FaceTime or Zoom. We have over-the-counter items that you can order through our catalog, 100 every quarter. And the fun thing about ours is if you forget to order, it rolls over to the next quarter. So by the end of the year, if you haven't spent any money, you've got $400 waiting in that catalog for you to spend. Fitbit, that's my little watch right here. It counts my steps. We give those to our members as well. There's no charge to you for a Fitbit. We have a little system going here. We want you to take some vitamins over the counter. We want you to go to the gym with silver sneakers, and we want you to walk with using your Fitbit. So we're trying to get you healthy or keep you healthy. And in case you're not, and you ended up in the hospital, when you come home from the hospital, we have a benefit called Returning to Home. Returning to Home is going to give you 40 hours of extra help at home, where someone can come in and help you do your house cleaning, maybe take a bath, get you dressed in the morning, maybe even do your laundry, change the linens on your bed. We give you 40 hours for the year. That would be 4-hour increments. And then we also include 28 days worth of food. As long as you had a hospital stay, you just have to call Scan within 7 days, and we will send out food for you, 28 days, which totals of 84 meals, no charge. The same with the help at home. And then the emergency response system is also offered to our members. That is at a zero copay, and that again is the one where you see the commercial where she wears a little lanyard around her neck and says, "Help, I fell, I can't get up." That's also provided to our membership. I am been doing this for over 30 years. I'd love to be able to help you. I know Medicare inside and out, so if I don't know the answer, I definitely know where to go find it for you. And like I said, if you enroll with SCAN, you will also enroll with me because I will be there to help you all throughout the year. So please remember to jot down my number. It's 714-272-8983. It's Joanne Boudet at 714-272-8983. Thanks. I look forward to hearing from you. And now you're going to hear from United Healthcare.
With United Healthcare, and I'm going to give you my number. This is my cell number if you want to reach me after this meeting. My number is 714-292-3796. I want to give you just a little bit of information about United Health Group. It is a Fortune 5 company again this year, and it has the most Medicare Advantage members in Southern California. So I just wanted to share that good information with you. It's a very stable company and it's been in business for a long time. So let's talk about the benefits now. The star rating for this year is going to be 4.0. And most like all the other plans, the premium is 0. And physician, the primary care specialist, virtual visits are all 0 copay. Then out-of-pocket maximum, this year it has gone down to $800. Every year the benefits just get better and better, and I'm excited to share some of the increased benefits and decreased costs with you today. Hospital copay, 0 copay, unlimited amount of days. The emergency room, if you go to the emergency room and you're admitted, it's going to be 0 copay. If you're released, it's $90. And again, this is going to be worldwide. All of the medical benefits with United Healthcare are worldwide. Let's see. Now, ambulance copay, it's gone down as well, so it's $130. And I always tell my clients to be sure to call the city to see if you could get the paramedic program with the city. They have a great plan. It's $5 a month. They attach it to your water bill. Now let's look at the outpatient surgery. It's going to be 0 copay whether it's in the hospital or outside facility. Skilled nursing, here's another benefit that got better, is days 1 through 20 is going to be 0 copay. Days 21 through 28 is $100 a day, and then that goes back down to 0 for days 29 through 100. So for 100 days in the skilled nursing facility, you're only going to pay $700 if you stay that long. Labs and x-rays are all 0. And here's another benefit. MRI, CT scans drop down and from $50 to now 0 copay. Diagnostic tests of physical therapy, all 0. Whether it's physical therapy, speech therapy, occupational therapy, all 0 copay. Urgent care. If you go to the urgent care within your network, it's going to be 0 copay. If you go outside of the network, it's going to be $20. But worldwide, it's 0. Let's talk about the medications. Tier 1 and Tier 2 for 30 days is going to be 0 copay. For 100 days, it's going to be 0 copay as well. And then for Tier 3, here's another reduction in cost. It's $35 for Tier 3 for 30 days or $95 for 100 days, and that's down $36. Insulin, if you are insulin dependent, that's $35 a month for your insulin or $95 for 90 days, and that stays true through the coverage gap as well. Tier 4 is $100 for 30 days and $290 for 100 days, and then 33% for Tier 5. Tier 1 and Tier 2, if you do go into the coverage gap, is going to be covered. So those will be 0 copay. Now, the dental coverage, you get up to 3 cleanings a year with an HMO dentist and zero copay for some of the comprehensive work, and you get $500 limit for comprehensive. However, if you want to go with our Platinum Dental, that is a buy-up, and you can have a PPO dental and get $1,500 worth of benefit. Hearing aids, here's another reduction in cost. It went down to $375 to $1,425 for your hearing aids, and you can get 2 hearing aids a year. And for vision is $300 for frames, and the lenses are included, which is great. Now we also have the Renew Active, which is the health club membership. Renew Active is like is a gym membership, but it has other health benefits. It's got brain games, it's got recipes, it's got a lot of different things. Plus, if you do certain activities like getting your mammogram or your annual physical, you're going to get reimbursed from the company. They're going to send you some money for that, up to $150 for the year. Transportation, you get 24 one-way rides, and some of the extras. Now here's some really good things. Chiropractic and acupuncture, 20 visits each per year at zero copay. And over-the-counter products, you get $50 for over-the-counter products per quarter, but if you don't use it, you lose it. And the emergency response system is zero copay, plus the monthly service charge is free. Podiatry, you get 2 visits a year for a non-referral for a podiatrist, but if you need medical attention to your feet, you need to go through your physician. Now we have another service right now. It's called Navigate. For me, it's kind of like a concierge service for if you've come down with a chronic illness or cancer or whatever, they will assign someone to you to help you get your appointments in order and get everything taken care of for you. We also have a chronic plan this year, and then Medicare supplement, which is like a PPO, and we have 3 RX plans to go along with that. So as you can see, the benefits have gotten really good this year, even better than last year, and be happy to help you get enrolled in one of these plans. Again, my name is Rosalie Pulio, and my telephone number is 714-292-3796, and I would be your agent, so please feel free to call me, and I'll be happy to work with you. Thank you so much, and here's Henry.
All right. A lot of great information. I'd like to thank Jeanette and all the representatives from the different health plans for taking the time to share with us some important information for you. It's a lot of information. As you know, you can look on our YouTube channel and you can see the links that have the presentation and the worksheets on. So feel free to go on the YouTube channel and pull down those links and print those that information for you. Secondly, is we have more. If you go on to our calendar and you look at our YouTube channel, you'll see more presentations throughout the open enrollment period. It's a lot to take in at one time. But most importantly, I want to thank you for taking the time out of your afternoon to sit with us and let us share with you some of the benefits and some of the features of Hoag Hospital, Hoag Medical Group, our physician partners, but more so the health plans, and using these tools to help you make the right decision that best fits you. So once again, thank you very much. Have a great afternoon, and we hope to see you soon. Thank you very much. Bye-bye.